Hearing loss is a common problem caused by noise, aging, disease, and genes. It affects one-third of the retired population before age 75 and nearly half after that age, but some people may not want to admit that they have hearing problems. Older people who do not hear well may become depressed, or may inhibit contact with others because they are frustrated or embarrassed by not understanding what they are being told. It is sometimes mistakenly thought that older people are confused, unresponsive, or uncooperative, but what really happens is that they do not hear well. If these problems are ignored and left untreated, they can get worse, with all that implies. It has been seen, for example, that older people who lose their hearing are at greater risk of developing dementia, and that their cognitive abilities, including memory and concentration, deteriorate more than those of normal hearing. So, as we see, it is not just about hearing well, but even about protecting mental health. Yes, you have heard well. If you don't believe me, I leave in the description the links to the studies in which these associations are established. This is why hearing aids, certain medications and surgery are of enormous value because of the multiplier effect on the health of the individual. Since it's hard to admit that one has trouble hearing, here are some clues. If we can't hear well on the phone, it's hard to follow conversations when two or more people are talking. We often ask people to repeat themselves. We turn up the volume on the TV until others complain. The background noise bothers us. We think others are mumbling, or we find it hard to understand women and children. Then we have to admit that we need to see a specialist. There are two general categories, the first of which is sensorineural hearing loss, which occurs when there is damage to the inner ear or the auditory nerve. This type of loss is usually permanent. The other category is conductive hearing loss, which means that sound waves cannot reach the inner ear. The cause may be a buildup of wax in the ear, fluid, or a perforated eardrum. Medical treatments or surgery can usually restore conductive hearing loss. Having made this classification, it is worth considering the following particular cases. Sudden sensorineural hearing loss, or sudden deafness, can happen to a person all at once, or over a period of up to 3 days. It is a medical emergency. If you or someone you know is experiencing it, seek medical attention immediately. It is associated with aging, appears to be hereditary, and may occur due to changes in the inner ear and auditory nerve. Presbycusis may make it difficult for a person to tolerate loud sounds or understand what others are saying. It usually occurs in both ears, affecting them equally. The loss is gradual, so a person with presbycusis may not realize that he or she has lost some hearing. Tinnitus is also common in older people. It is often described as a ringing in the ears, but can also sound like roaring, clicking, or whistling. It can come and go. It can be heard in one or both ears, and can be loud or soft. Tinnitus is sometimes the first sign of hearing loss in older people. Tinnitus can accompany any type of hearing loss and can be a sign of other health problems, such as high blood pressure, allergies, or as a side effect of certain medications. Tinnitus is a symptom, not a disease. Something as simple as some earwax blocking the ear canal can cause tinnitus, but it can also result from other health conditions. But is there anything we can do to avoid these problems? Well, of course, it will be easier to prevent them if we know the causes of hearing loss. It is known that we all lose our hearing slowly over the years, especially if, because of our profession, we have been exposed to loud sounds for a long time. This is noise-induced hearing loss. It is most common in construction workers, musicians, airport workers, or members of the military. Loud noise also contributes to tinnitus. The good news is that these noise problems can be prevented by limiting our exposure to noise, both in time and intensity. Earwax or fluid buildup can block the sounds that are transported from the eardrum to the inner ear. If wax blockage is a problem, there are simple ways to fix it, either by your own means or in our health center's infirmary. A perforated eardrum can also cause hearing loss. The eardrum can be damaged by infection, pressure, or by placing objects in the ear, including cotton-tipped swabs. By the way, I take this opportunity to say that ear swabs should be called earbuds because they are designed for hygiene of the outer ear only. If we have pain or if fluid comes out of the ear, it will be necessary to go to the doctor. Common health conditions in older people, such as diabetes or hypertension, can contribute to hearing loss. An otitis media, a heart condition, a stroke, a brain injury, or a tumor can also affect the ability to hear. Behind this problem may be certain medications, called ototoxic drugs, which can damage the inner ear, sometimes permanently. Some medications used for serious infections, cancer, and heart disease, as well as certain antibiotics, fall into this category. Even aspirin, at certain doses, can cause problems. You should let your doctor know if you notice problems when taking a medicine. Deafness can be associated with genes, but it doesn't always occur at birth. For example, in otosclerosis, which is thought to be a genetic disease, abnormal bone growth prevents structures inside the ear from working properly. And that's it for today. All that remains is for us to discuss how to deal with hearing loss, whatever its origin. Thank you very much, and until the next video.